Born at 9:38 yesterday morning, Charlotte Morrison was already primed for her close-up. Visiting rules at the hospital currently prevent family and friends from lining up to see her straight away. But Mum Jacqueline says thankfully all went well.
From finding out I was pregnant to coming into that age to having my daughter, it's just been nothing but easy sailing. Everybody's been so friendly and so kind to us, so we couldn't ask for anything more. We're quite family orientated. We will miss it, but hopefully we'll be home tomorrow and they can come and visit us then. I've already started booking people in and days and stuff, so they'll still get to see her.
But staff say the last-minute absences due to COVID are putting pressures on a staff group already lacking in numbers.
It's been very stressful for people because when you come into work you want to know where you're going to be working that day, and that's not always been the case throughout the pandemic. But the staff have absolutely been so flexible and hard-working, and they've all come together and we've all got that shared goal of we want to provide a service for women, and I think that's what's got us through.
The NHS is seeking to recruit more people to the profession. Retired midwives returned to service during the pandemic and have continued to work part-time, which is helping to bridge the experience gap. Student nurse Hannah is on the cusp of qualification after a mix of online classes and practical experience over the last 3 years.
I think definitely being on the ward gives you a reality of what it is to be a midwife, especially with the understaffing through COVID. But we're lucky enough as students to have great mentors for support and mentored every step of the way through our experiences out in clinical placement.
Midwives have prided themselves on how they diversified their care during the height of lockdown.
We looked at lots of different ways as to how we can reach our patients. So from there, we were doing more home visits, we were doing video calls, we were enabling home births where we could, just to make sure that we were still able to support the patients in the best way we could.
With restrictions easing and isolation no longer required, staff hope the pressure will ease and they can focus on the job at hand. Evanna Holland, STV News, Paisley.